girlfriend.
You got girlfriends? Really?
And that's an understatement for this Smith County 4-year-old.
He has a lot of girlfriends. Baby, baby,
baby. There's always a gathering. He has quite the personality.
He always keeps the unit alive, that's for sure.
He's nothing like any of the other patients we take care of. He's a spitfire, that's for sure. You'd never know he was sick, needed a heart. As bad off as his heart was, you'd never know it.
Just days earlier, KJ Page became the 4th child since September 2011 to receive a heart transplant at Batson Children's Hospital.
You feel a lot better today, don't you?
So yes, sir.
You look good.
Okay, you messing up all this red
Yep,
paint.
I do.
KJ is a little guy who's been here for several months now with a cardiomyopathy, so a very weakened heart muscle, and he's required continuous care for the last couple of months while he's waiting for a heart transplant.
He was born with a rather unusual version of a defect that alters the blood supply to the heart muscle itself, the coronary arteries. And so the problem with that is that the heart doesn't get enough blood flow. And so as time went by, his cardiac function decreased, and he was not seen here until last year. So up until he was 3 years old, nobody knew what the problem was. The surgery itself is actually, despite what it sounds like and what it seems to most people, it's actually sort of like a 5 out of 10 in terms of difficulty level, because the heart that you get is always a good one, because that's why we choose it. And so the operation itself, just doing the sewing, is actually really not that technically challenging. What's difficult about heart transplant is the medications, the anti-rejection medication, watching for infection, the biopsies that have to be done, and all the work that goes into it afterwards is actually where the real work lies.
And that's something Andrew Carroll and his family knows a lot about. 20 years ago, Dr. Bobby Heath performed the first pediatric heart transplant in Mississippi on a Rankin County 5-year-old.
Dr. Heath did all of Andrew's surgeries, the 4 before the transplant and the transplant. He took out his pen, he drew right there on the hospital bed sheet a picture of Andrew's heart and explaining what he was going to do and how it was going to be. And it was scary knowing, though, that we were going to be basically the first, and it was like, they don't have a lot of experience, but we relied on them.
We didn't know if he was going to live or die. So it was pretty tough on all of us.
They said, Dr. Heath's on the floor, and we were like, why is he on the floor? And he said, he's exhausted. He's just sitting on the floor beside Andrew's bed. He's just sitting there.
I remember nothing, to be honest with you.
Did you feel limited at all as a child?
No, not at all.
Got to do what you wanted to do?
I did, and that was a benefit of the surgery.
He's a miracle. Thank God, he's a miracle.
What do you do now?
I go to Ole Miss. I'm obtaining my master's in Spanish. So,
¿Qué casualidad?
¿sí? ¿Tú puedes hablar?
Sí. Mis padres son peruanos.
Ah.
Well, it really shows you what transplantation can do. It can give somebody a normal life. And that's what we're really excited to provide for these children, and then they grow up to be adults. So it's fantastic. And this is exactly what we want to bring to all the children in Mississippi that need heart transplant care. So we're going to continue what Dr. Heath started.
I'm just really proud universities crank back up and ready to go.
I suspect that we would probably end up doing maybe 6 or so a year, 6 or 8 a year, which would put us kind of where you would expect to be for a medium to large volume center, which is what we're becoming.
We have a lot of kids here in Mississippi that need this heart program, and I just don't see it going anywhere but up.
It came down to the care of the parents before they got here, but really afterwards, they've really got to...
Oh, they have to step up. They have so much of a responsibility now, even more than before, but they have all done really great with it.
He'll take rejection meds. There will be anywhere from 2 to 3 rejection meds daily that he'll take. And then he'll take other things for heart health. And then he'll take things to prevent infections as well, because, again, you're going to kind of suppress the immune system. And so with that, you also have to prevent infections. So there will be a couple of different medications to prevent any kind of infections that he could get along the way.
And that's just a lifelong routine he has to get into
the habit of.
Take your medicines. It is a pain sometimes to get them organized and take them, but it's a lot better than what could happen if you didn't.
And you may have to set some limits, but you know, to let them be a child, let them grow, let them be themselves, let them develop their own personality, and not to have that diagnosis be something that's going to keep them from achieving things.
There's no reason why his course should be any different than Andrew's. He waited for months, which just sort of reflects back on organ availability and the necessity for everyone's awareness about how important that is when you are in a position where you have an opportunity to give a gift like that.
Andrew and KJ have a lot in common. Both spent months at Mississippi's only children's hospital, surrounded by hundreds of caregivers and devoted mothers who never left their side.
His mother's been here nonstop. She's been here, day in and day out, 24 hours a day, basically.
He's an active kid with the heart problems. What's he going to be like when he's 100%?
Driving somebody crazy.
Turbocharged.
Thank you.
Who's that going to be?
Me and my mama. Me and my mama. He gonna drive us up the wall.
It'll be tough to see him go, isn't it?
Oh yeah, everybody's very attached to him, and he's been a very entertaining part of our day.
Bye-bye.
KJ, he's a busy man.
I want to see your trucks and toys. What do you have? I want you to tell me about your boots. I would say boots. You're only wearing one of them, though.
I got a Converse on one foot and a boot on one foot.
That's a good look. I like it.
It's the new style.
What's your favorite toy? I like this car.
To learn more about pediatric heart transplants at Batson Children's Hospital, go to childrenshospital.umc.edu. I'm Jim Albritton reporting.
Those are all cool, huh?
Will you play with me?
I wish I could play longer.